everyone, my name is Savanna. I'm the exercise physiologist and wellness coordinator for HealthTeam Advantage. Today we're going to be talking a little bit about diabetes and hypertension, how exercise can be included in your healthy lifestyle. Just a few fun facts for you real quick before we get started. 50% of Americans have high blood pressure and 1 in 10 Americans have diabetes. 1 in 5 of those Americans don't even know that they have diabetes. So these are very serious conditions that a lot of the United States population has, and mostly that is due to lifestyle habits. So that could be diet, it could be sedentary lifestyle, but the good news is that you have the ability to change these factors. So it's not something that you're born with necessarily. So you can definitely change your lifestyle to make a healthier life for yourself as time goes on. So we're gonna go over a little bit about hypertension. What is hypertension? What does that look like? And then about diabetes. So first off, high blood pressure forces our heart to work harder to pump blood through our body due to narrowing of our blood vessels. So you may acquire plaque around your blood vessel that makes it more narrow, just harder in general for blood to get through to important organs such as your brain and things of that nature. So it makes your heart work harder. And hypertension can have many side effects such as stroke, heart attack, vision loss, kidney disease, and more. So even though it is common in the United States population, it is not a safe condition to have. So you want to make sure that if you do have high blood pressure, it is well maintained, and you either do that through medications if your doctor prescribes it, or through exercise or diet changes. So risk factors for high blood pressure include age, lifestyle habits, like I said before, genes, sex, and race. So all of those can have an impact on hypertension. We're going to go over the quick blood pressure categories. These are important because the American Heart Association actually changed these numbers a few years ago. So not a lot of people are aware of the changes. So before the change was made, it was 120 over 80 was for what you were shooting for. And now you're looking for less than 120 and less than 80. So less than 120 for your diastolic or systolic number, less than 80 for your diastolic number. So that's the top and the bottom number. 120 over 80, you're looking for less than that. So that's gonna be normal. Elevated is 120 to 129 for systolic, less than 80 for diastolic. High blood pressure or hypertension stage 1 is going to be 130 to 139 for your systolic and 80 to 89 for your diastolic. High blood pressure hypertension stage 2 is going to be 140 or higher for systolic, 90 or higher for diastolic. And a hypertensive crisis is an emergent situation where you need to talk to your doctor immediately, and that is higher than 180 for your systolic and higher than 120 for your diastolic. If you are finding these numbers, you really need to speak to your physician so you can get that lowered immediately. We want to take our blood pressure pretty regularly, especially if you're 50 and over, because age can have a factor in hypertension. So you want to know how to take your blood pressure accurately if you're going to take it. And it is really important that you know what your typical blood pressure is, just so you can report it to your doctor if things change, and you can get ahead of the game as far as hypertension goes. So how to accurately take a blood pressure assessment. You're gonna wanna sit quietly, not talking, for about 5 minutes, just to get your blood pressure down, your heart rate down, so don't be walking around a bunch before this. Make sure that you're not taking any caffeine, so no coffee right beforehand, exercise, or smoking, so you should avoid these a few hours before taking your blood pressure. Make sure your legs are uncrossed and flat on the floor. So a lot of people will cross their legs when they sit down. So try your best to keep your feet flat on the floor. Make sure your bladder is empty, your back is supported upright, and your arm is supported at heart level. So at the doctor, you may go in and they always have the chairs where you can put your arm right here. So this is relatively where you will want your arm, just right by your side here, relatively at your heart level. You want to make sure you have an appropriate size cuff. If the cuff is too small they're too large, you're not gonna get the correct number. So if the cuff is too small, the number is gonna be higher than it usually would be. If the cuff is too big, it's just not gonna be accurate. So make sure that the cuff fits your arm appropriately. And the American Heart Association standards state that blood pressure should be measured 3 times in each arm, separated by at least 1 minute an average. That's if you don't already have a good idea of what your blood pressure usually is. So that's to get an accurate number for yourself. Next, we're gonna move on to what diabetes is. There's 3 main types of diabetes. First, we have type 1 diabetes, where your body does not produce enough insulin. Type 2 diabetes, where your body produces insulin well, but it can't use it. And then 3, we have gestational diabetes, which we're not actually gonna cover today. So type 1 diabetes and type 2 diabetes are what we're actually gonna cover today. The way diabetes works is, especially for type 1, we'll go over type 1 first, the body doesn't produce enough insulin. So insulin actually binds to glucose. When you eat, your body breaks down what you eat, and it breaks it down mostly into glucose. So you have glucose or sugar floating around in your blood. Usually, in a healthy body, your insulin will bind to your glucose and it'll take it where it needs to go so your body can have energy. Now, in type 1 diabetics, your body's not producing enough insulin. So that's why people would take insulin, right? Because they want to bind that glucose so that their blood sugar will come down. Now, if you have type 2 diabetes, your body is producing the insulin it needs. It's just not receptive to the glucose anymore. So you'll have free glucose just floating around and your insulin won't be doing anything about it because it's not sensitive to that glucose anymore. So that's kind of how those 2 things differ. Type 1 diabetes, you can be born with that. Type 2 diabetes typically comes from lifestyle type habits, but really, your mileage may vary for those 2 things. But generally, those are the things that come out of those 2 types of diabetes. So diabetes can lead to complications in many parts of the body and increase the risk of dying prematurely. This can increase the risk for stroke, blindness, heart attack, kidney failure, as well as leg amputation. So we want to make sure that our blood sugar levels are where they need to be, because these can cause serious damage to our bodily organs and cause heart attacks and problems with eyes, nerves, things like that. So we want to make sure that this is in check. So how exercise can help? Exercise can help significantly, as well as diet, because with physical activity and hypertension, physical activity can help make your heart stronger to pump more blood through your body with less effort. So your heart can actually get stronger with cardiovascular exercise, and with exercise, your blood vessels actually widen just a little bit. So when you exercise, you may notice that your systolic blood pressure, which is how hard your heart is beating at any particular moment, that number actually goes up, okay? And then you may find that your diastolic number, which is kind of the pressure in your vessel between beats, goes lower. And that's because your vessels dilate just a little bit. So you may find that the systolic number goes up during exercise just slightly, and then the diastolic may go down or it may stay the same. So that's kind of the changes you can look for during exercise. Now, after exercise, chronically, your blood pressure will go down overall because your heart is getting stronger, etc. Physical activity and diabetes. Activity and exercise makes your body more sensitive to insulin and utilize more glucose. So your body needs energy when it is exercising, and it uses that glucose for energy. So like I said before about the insulin binding to your glucose, you want that to happen. You want glucose to be taken out of your blood so that your blood sugar comes down instead of staying elevated. So this can make the complications associated with diabetes much, much less. Considerations for hypertension before exercise. The American College of Sports Medicine recommends that individuals with hypertension engage in moderate intensity exercise or aerobic exercise 5 to 7 days per week, supplemented by resistance training 2 to 3 days per week. And you can add in flexibility exercises 2 to 3 days per week as well. Now that sounds like a lot just coming at you at once. Okay, so really you could split this up, and I'm gonna show you a way to do that at the end of this PowerPoint slide. We're actually gonna go through some exercises so that it doesn't seem like overwhelming, because 5 to 7 days per week of aerobic exercise and 2 to 3 days per week of resistance exercise seems like a lot. you can really condense that down. And when you're first starting exercise, you really want to just start a routine. So the more consistent you can be, instead of just exercising here and there when you feel like it, is going to be the better for you. So consistency is really key. If you can be consistent with 2 to 3 days per week of exercise, great. That's awesome. So really anything that you can do and stay consistent with is going to be the best thing for you. So while I'm telling you the recommendations, you do not have to follow these. Follow what you can stay consistent with. And note that inhaling and breath holding while engaging when lifting weights, it's called the Valsalva maneuver, can result in extremely high blood pressure responses, dizziness, and even fainting. And this should be avoided during resistance training. So if you have high blood pressure, that's gonna shoot your blood pressure up out the roof. You do not want that. So don't inhale a breath, hold it, and really strain while you're lifting weights, or hold your breath at all while exercising, because this can really increase your blood pressure, and you don't want that. And lastly, talk to your doctor before exercising if you have uncontrolled high blood pressure. This is why taking your blood pressure regularly is so important. You want to know what is normal for you. You want to know how you respond to different medications your doctor may prescribe you, how you may be doing as far as exercise goes, which may lower your blood pressure, things like that. So make sure that you are taking your blood pressure regularly. You know if it's controlled or not. You know if it's high or not. So make sure that you're taking that on a regular basis. I have a great infographic here from the American College of Sports Medicine for 6 tips with physical activity and diabetes. So you want to make sure that you're doing regular aerobic exercise and generally high intensity resistance exercise. Those 2 things are great. So regular aerobic exercise is using that glucose, like I said before, for energy. So it's overall lowering your blood sugar. And then high intensity resistance exercise, when performed safely, will help more than low to moderate intensity exercises will, just because again, you're using more energy. Be active after meals. So if you find that your blood sugar spikes a lot after meals and you take your blood sugar regularly, being active after meals may help with type 2 diabetes, reducing blood glucose levels. Avoid crashing during or after a workout. So if you use insulin, make sure you talk to your doctor, number one, so you can make sure that you're taking your insulin when you're supposed to. As far as exercise goes, you're not taking it right before or right after, and that's a wrong time for you. So just make sure that you're talking to your doctor beforehand. But make sure that you are supplementing with carbs to avoid crashing during your workout. So if you find that you're getting lightheaded and you have any symptoms that could mean low glucose to you, make sure that you're taking a carb-filled snack with you so that you have that ready. And for those who take beta blockers when it comes to diabetes, beta blockers can actually stunt your heart rate. So what I mean by that is that it just lowers your heart rate in general. So don't go off of your heart rate for intensity when you're doing your exercise. So a program may recommend that you be exercising anywhere from 110 to 130 beats per minute. Your heart rate may only get up to 100. And then you may think you need to work harder. That's not the case. If you're on beta blockers, do not go by your heart rate for exercise intensity, and definitely talk to your doctor again before exercising if you're on beta blockers. When to schedule workouts, try and schedule your workouts after meals instead of before them. Again, after your meal, it's just going to utilize the glucose in your system way better than it would obviously before a meal. And you want to make sure that your blood glucose isn't going too low as well as getting too high. So just maintaining that is really optimal. So we're gonna go over really quickly some exercises here. So really you can start to feel the difference of exercise pretty quickly. So just a short workout, getting your body moving, getting the blood flowing and your heart pumping, you can start to feel the difference of exercise pretty fast. The exercises that I'm gonna show you today they're in a circuit style fashion. So they're gonna be back-to-back exercises. And this is gonna keep your heart rate up. So we're gonna be using our glucose for energy. Our heart is gonna be working for our hypertension. So our heart is gonna be getting stronger. And I've actually put a cardiovascular exercise and a resistance training exercise together. So you're getting these together, your heart rate staying up while you're doing resistance exercises, which can really be helpful. in utilizing your time better. So I have 4 sets of exercises that are back to back. You can do these really in whatever order you want. I'm prescribing them to be 3 times over. So we're only gonna do them 1 time over today, but if you were working out at home, doing these 3 times over is gonna probably yield you the best results. If you find that it gets easier, you can either increase the weight or you can increase the amount of time that you do these exercises. So those are all options for you. If you don't have weights at home, I have weights over here that I'm gonna be using. But if you don't have weights at home, it's totally okay. You can use soup cans as far as this goes, a jug of milk, whatever you find that you feel comfortable with, you can totally use. The rest of the workout is just using your body, and we're gonna actually be using a wall back there. So we're gonna get started. I'm gonna grab my weights really quick. So these are weights that I bought off Amazon. We made a video a little while back about the weights. I think that I talked a little bit about the weights and bands and what to get and what is right for you. So if you haven't seen that video, go back on our YouTube page and check that out. So our exercises, like I said, are gonna be back to back. So we're gonna be doing a cardiovascular exercise and a resistance training exercise. So our first one is a side step with a jack. So you can't see my legs right here, but I'm stepping over and coming up. Stepping over and coming up, and I'm alternating my legs. Now this is technically a cardiovascular exercise. This is just a side step jack, okay? And you can't see my legs, but it's okay. We're gonna be doing 10 of these. I think I'm on 6, I always get confused when I'm talking. So we're 7, 8, 9, and 10. All right, after that, we're gonna go to our lateral raise. So we're working our shoulders here. Our elbows are gonna be tucked. Our shoulders are gonna be back. So we're standing up nice and tall, and we're coming out and back down, nice and slow. This is a very slow and controlled movement. My elbows are not locked out with this exercise, so they're not straight. They have a little bit of bend in the elbow, and then we're coming right back down. This is a great exercise for your shoulders. If you have shoulder pain, don't go as high, right? So we can go low here. And like I said, if you don't have weights, it's okay to use soup cans, it's okay to use milk, really whatever you have laying around the house that is easy for you. So that was our back-to-back exercise, okay? You can repeat that 3 times to get your heart rate up, keep your heart rate up, and then we would move on to the next exercise. So we're doing 3 sets of 10 for each of these. I'm just showing you 1 set of 10 for each of these. Next, we've got our high knees. I'm actually gonna put these weights down. If you need to have a chair for this one, it's okay. So we're gonna come up and back down. You're gonna wanna move at a pretty good pace to keep your heart rate up. But again, we're gonna be doing about 10 of these on each side. This is number 4, 5. If you can't get your leg up this high, that's okay. Just moving around is the best thing that we can do. So we're gonna do about 2 more of these on each side. 1 more. Good, that was also helping our balance. That's a great exercise to get your heart rate up, help you balance. And next we're gonna go to our wall push-up right afterwards. If you've never done a wall push-up before, I'm gonna use this wall behind me since you can't see the front of me. We're gonna tuck our elbows into our side here. And the farther away you step away from your wall, the more difficult the push-up is gonna be. The closer you are to your wall, the easier it's gonna be. So you can really adjust this however you want. This is working our triceps, it's working our chest, it's working the front of our shoulders. So I'm gonna go over here and do a few just so you can see me do them. Again, this is what this looks like. All right, so at home you would do 10 of those, again for 3 sets. So 3 times over, you would do the high knees and the wall push-up, and then we would go to our next exercises. So our next exercises, we have our step back jack. Step back jack has a funny name. We're actually gonna take our weights out to the side and come into the middle. Now, you can't actually see me step back, but I'm stepping back with 1 leg, bringing it together. Stepping back, coming together. This is really helping our balance. This is a great exercise for balance. This is a great exercise for your upper body. So we're getting resistance training, we're getting our cardio. If you want your heart rate to be a little higher, go a little faster. It's okay. You can go at whatever pace suits you. You can go a little slower, right? It doesn't matter. We're gonna do 3 more of these. 1 more. All right, so those are step back jack. With all of these, make sure you're standing up nice and tall. We want to always work on our posture when we're doing exercises. It can really help all of these muscles back here, so just make sure that you're rotating your shoulders and standing up nice and straight during all exercises. And then we're gonna go to a partial squat after that. So if you need a chair, you can definitely hang on to a chair, that's fine. You can have your weights here at your chest, which I prefer because again, it tells me to keep my chest up, keep my back flat, okay? So from here, I'm gonna come down a little bit with squat and come back up. And you can see that I'm not bending over at all. So I'm not doing this, coming down. If you find that you're doing that, you bring your weights here by your side and come back up. Again, we're doing 10 of these. I'm talking, so my numbers may be a little off. You can hold them here. You don't have to go down very low. If this hurts your knees, just go down a little bit. It's no big deal to modify it how you need to. So if you find it too hard, too easy, if you find it too easy, go down a little bit lower. If you find it too hard, again, you can use a chair for support, whatever you need to do to modify it for yourself. So again, 3 sets of those back to back for 10 reps each. And our last set of exercises are our butt kicks with an RDL. So our butt kicks are similar to our cadence here, except we're gonna be kicking back. So you can't see super well over here because I don't have a ton of room where I'm filming, but I am kicking back at a good pace. This is great for getting range of motion in your knees and keeping your heart rate up. I am using my weights here just because it's good to have, again, to keep the core tight. Just have something here so that you can be standing up nice and tall. So again, you're gonna do 10 on each leg for these and get your heart rate up nice and high. After that, we're gonna go to what's called an RDL, Romanian deadlift, straight leg deadlift. It's not as scary as it sounds. So we're gonna come out here. Our weights are gonna be right at our leg and our chest is gonna be up, back flat. So we're gonna push our butt out, back flat, and when you feel it stretching your hamstrings, come right back up. Come down, stretching your hamstrings, come right back up. So this is helping our lower back, it's helping our hamstrings, helping our glutes. So we wanna make sure that our posture, again, is really good with this one. We're doing 10 of these. I'll show you what this looks like from the front. You want your feet about hip width apart, maybe even a little bit closer together. It's gonna be a great one for your lower back. And if you do feel pain with this one, again, modify it to however you need. So you don't have to go as low. So again, those 2 exercises back to back are great. And that's your workout. So you have a total of what, 1, 2, 3, 4, 5, 6, 7, 8 exercises that you can do at home to keep your heart rate up, keep your muscles working, and it's really a great workout. So anytime you can put resistance training and aerobic stuff together, do that because it's just saving you time instead of going by the typical 5 to 7 days per week and then 2 to 3 days per week for resistance training. You can just put that together and make it less work for you. So again, anything you can stay consistent with it. Whether that's 2 to 3 days per week doing something like this, that's totally fine. Whether it's walking outside with a friend, totally fine. Going to the gym, whatever it may be for you, definitely just find what works. Again, you may have resources like Silver Sneakers, which is an amazing program, not only for online workouts, but also in your community. So definitely check that out. And yeah, that's it from me, guys. Thank you all for tuning in. Hopefully you learned a bit more about how to control your hypertension, how to control your diabetes, and I'll see you for the next YouTube video. Thanks.